I would request everybody to come up to the occasion, and let's get started with this second technical session for today. This technical session again focuses on public health crisis in India from a variety of perspectives. This session will be chaired by a very eminent Senior Administrator, Mr. KMASG, IAS Officer of 2009 batch from AGMUT Cater. He is the CEO of Delhi Urban Shelter Improvement Board, Government of Delhi. Dr. K. Mahesh is highly qualified with LLB from Delhi University, LLM from London School of Economics and Political Science, and MBA from Birmingham University, the UK. He was earlier posted in Delhi as District Magistrate. He has been conferred with the Best DEO Award by Delhi government for his innovative and out-of-the-box thinking to have democracy on wheels. Mr. K. Mahesh has written extensively on civil services reforms and judicial reforms and has co-authored a book on judging the judges in 2000, which was reviewed by The Telegraph and India Today.
Good afternoon, ladies and gentlemen. It's my privilege and honor to chair this technical session number 2. And I'm grateful to Professor Chanchal Sharma and the institution which has organized this great international conference. Friends, let me say a few words that I'm doubly privileged. First is on my right I have Nidhi. She is Deputy Secretary, Department of Personnel and Training. And on my left I have Shefali Dhingra. She's from the Indian Economic Service. And of course Professor Ajay Kumar Singh. Well, Rupak Chattopadhyay won't be able to join us. He'll be doing it later in the evening. And I have Shefali Dhingra. She's from the Indian Economic Service, 2004, ma'am. Director, Central Electricity Authority, Ministry of Power, Government of India. She has studied economics and law from DU and has worked in the fields of public policy in multiple sectors such as finance, expenditure, management, and power. Nidhi is a 2010 IAS officer of the Agmut cadre. And she's currently Deputy Secretary, Department of Personnel and Training, and she was the Deputy Commissioner, Central District, when we had this pandemic, and she handled the migration issues. So it's a very distinguished panel, I must say. So we have a professor, policy expert, and of course, a bureaucrat in action. So friends, before we start, I would request Nidhi, you see, the academic world is good in reflection. And the bureaucrats are good in action. Professor Nirvakar Singh also said the bureaucrats played a critical role and they did very well. So let's first get started and we'll have a presentation by a civil servant, Ms. Nidhi Srivastava. So friends, let me say a few words first. India is a basket case of continuing crisis, and we have been handling this crisis, resolving this crisis during the last 75 years. We have a legal framework. In the constitution also there is a provision for the regarding relief and rehabilitation in the concurrent list. And this was there when India and Pakistan, when we had these two countries, and to settle the refugees, we still have a provision, which is still there as entry number 27 in the concurrent list. And regarding, in the union list also, we have a provision which is related to our disaster management. But the most important development which has taken place in the country was in 2005. This was because of the series of disasters which we faced, man-made and natural. We had Gujarat earthquake, Odisha cyclones, and we came out with the Indian government, the parliament, they enacted the Disaster Management Act. So, and this act is certainly, it takes care of a lot of issues which has been discussed, including local government. Let me tell you, yesterday somebody said, look, the local government is not involved. It is there in the Disaster Management Act. And under the Disaster Management Act, under Section 3, it gives power to the Prime Minister to take decision which can be ex post be ratified. That's very important. And of course, there are other provisions which we can discuss later. But first, let's get started with Nidhi. Yes, madam.
Good afternoon, ladies and gentlemen. So I would rather want to present the whole thing not theoretically, but just like a story of how I probably faced it. So if we see the next slide, the COVID-19 pandemic and public administration role of IAS. Next, please. So it was an afternoon, February 20th, if I remember. So we were generally sitting, and there was one presentation and a video conference which happened with central government of all the district magistrates, and we were told to attend the presentation. As luck would have it, Sanjeev sir is already here. Sometimes when we are at the field level, we are like, again, another presentation. So, but then we were told, so we may attend. When they say we may attend, that means we have to attend. So we though rather reluctantly sat in front of our computers, and they were like, there is some pandemic which is happening. I still attended the meeting, and they said that something has hit in China and several other countries, so you better be prepared. So I said, they keep telling all these things. India definitely will not get it. We will not get anything. So as district magistrate, very calmly, I was sitting down whole through the VC, and then I had sumptuous lunch with my friends, and I said, no, nothing will happen. And I think within 7 days, in the whole setup under the district magistrate, there are district surveillance officer who will look after this. There is district medical officer. So she just walked up to me and said, ma'am, do you know, the first case in Delhi has hit. So I said, absolutely, I'm sure it must have happened. She said, ma'am, it's our district. So I was totally blank. I looked at her, I said, what? She said, it is our district, and we have got the first COVID death. I still have the goosebumps because I didn't know what to do. Because I didn't know, except the spelling of COVID, I didn't know what it meant. Because that video conference that happened by the center for all the district magistrate, I was thinking about the lunch. So I said, okay, now what? And how has it happened? What I have to do? So this was a Majnu Ka Tila, the first challenge which we faced in Delhi. And I was told that this man traveled from Himachal and died in the Tibetan settlement, that is the Majnu Ka Tila settlement. And I said, why? I mean, he could have died anywhere. Why has he come to the district and died in Majnu Ka Tila? And I was totally clueless. And then I thought what to do, because there was no best practices, there was no precedent, and I can actually feel the same thing which I felt that time, 2 years back, 2.5 years back. And I said, now I really need to do something. So we contained the whole area, because there was some concept called containment zone, 3 kilometer this side, 3 kilometer that side. That was not possible. The whole Tibetan colony I contained, and I told the police officer, just close. And I tell you, that was the time when I realized sometimes as a bureaucrat, we do become autocratic. I said, just close Tibetan settlement. But then we did take care that the food, the vegetables, the milk supply, all was there. No order, nothing. And police was told to close the whole Tibetan settlement area. And I realized after the death, and the person was duly cremated, we closed it for 1 month. And everybody was asking me, Nidhi, what have you done? I mean, where did you get this? I said, I don't know, but I did it. There was again, now there was the series of video conference started. So we were told the health department of Government of India, Ministry of Health, they had a VC, and they asked me, okay. So suddenly I thought I was on the center stage, and everybody was asking me questions, and I did something which I didn't even know. So Majnu Ka Tila was first challenge which our district faced. And then of course we all know lockdown was imposed. Now lockdown actually brought a lot of challenges with it, which maybe we never thought it will come, but as a bureaucrat, and there where I bring in the role of IAS. When we are in the subdivision level, I served in Arunachal Pradesh, which is the far east of India, and at times people would not know the states, northeastern states, and I served there. So you would know that as a district magistrate or as the head of the subdivision also, you really have nobody. So just a small thing, when I had to play badminton, I used to play with my PSO. And I used to always win. I still think, how could I win? Because he made me win every time, whatever, however I played. So this is how you actually work when you are in subdivisional level or the district level. You are responsible for everything which is there, whether it is health, whether it is school, whether somebody dies, whether somebody is born, anything under the sun. So this, I think this training helped me when COVID struck. And when lockdown was imposed, we were of the view, how will people how will people get food? How will people get their daily supplies? How will we help people who are falling ill? How will we help the senior citizens, the pregnant women, the children, everybody who was there in that area? And just a brief about the district which I was heading. So it is a district, if any of you have ever visited the old Delhi Chandni Chowk area, it's a very condensed and very highly dense area. And so you have to handle the whole district in a certain manner. While we were just moving further with the lockdown and the Majnu Katila incident, there was one big incident that happened, and that was in other district. And again we were struck. Most of the time I felt that we were the people who were just bystanders and hit by something. So negative externality. So in one of the neighboring district, there was a congregation that was happening of a certain sect and religion. And they realized that the people who have moved out from foreign land are carrying COVID with it. So all the people, that 3,000, 4,000 people who were there in that congregation, they were all infected, because the people who were doing their work, the people who were congregating, the lecturers, the people who were attending the lectures, they were all infested. So we were told that now we have to transfer these people. Now how to transfer? So we just called some buses, something, and we just transferred all the people to places where they can be just kept and quarantined. But our people were very scared, the people of the district. And why should I only say that people of the district? Even I was scared. Because really, something which you are not aware of, how difficult it was, what is the way it is being, people are being infected. Some people were saying, touch karne se you can infect a person. Some people were saying, even if you speak in front of that person, you will get infected. So everything was fluid. And we were all tackling something which we had no clue of. This was the first containment zone which came in thing, and it was all over the Indian and foreign media, and that was the Chandni Mahal area. It was a 8-kilometer area which we contained with sheets like this, as you can see. And we covered the whole area, and the people who were there in that area were inside that area. So we tried to provide them for all the daily supplies. If there were some people who were ill, we tried to take them out and take them to the hospital. There were senior citizens, there were people which we had to cater with. And then suddenly I realized, why don't we start sending our people to doorstep and carry the oximeters? Why don't we carry the blood pressure to measure the blood pressure? And there was a thing that all the senior citizens, 60 and above people, are the ones who are getting infected. It was also at this time that we tried to map each and every house and each and every place where we saw the COVID cases. This actually helped in making containment zone, and that is how the first containment zone of Delhi came into picture, and it was widely covered also, and also because it was a big area. So now this containment zone carried on for a good 50-55 days, and we were nearing a very big festival of this community. And people just walked up to me, I mean the political executives. This is where I feel that we must discuss how, are they good, are they bad, whether they were helpful or not. So they said, Madam, you will have to help them, because in the morning, the people you have quarantined, one, and the people who are in their houses in the containment zone, they need to be given food. And they take food at 4 o'clock in the morning. So you please arrange, they call it Sehri, I think. So you please arrange this. So I said, okay, what do I do in that? They'll have fruits, they'll have everything, so you please arrange. Now I discussed with my people and my team, what do we do now? Now this was the time when we have to see that it is not only the containment zone, it is not only that heavy hand that you're using for the people, it is the soft bureaucracy that we have to exercise. And then we did try to see that we have to provide them food and whatever 4 o'clock thing that they have in the morning, and in the evening, I think at 4 or 5 o'clock, and we tried. When we were, this containment zone, Chandni Mahal was in question, then people did say that 50, 60 days you can't close. So all the political executives who were under a lot of pressure, they walked up to me and then they said, I think we need to work it out. So I said, no, we cannot open it. They said, no, but you have to do something. And I realized there was a point. So I feel as a district magistrate of a district, we also need to take inputs from these public people who walk up to you and they give you. Then I realized the GPS which we had, there is concentration of these COVID cases in a certain area. But rest of the areas which we had put in the containment zone are clear. So that is when we started this micro containment zones. So micro containment zones will have a smaller part of the whole containment zone. So we tried and open a bit so that even they are not feeling close, because we all were part of this pandemic. We felt so contained in our own houses, and there were emotional issues when you are not meeting your neighbors, you are not meeting your people who are staying nearby. So we started doing this containment zone. In fact, when we saw that there were houses in the clear area, we further started containing the houses itself with the help of police. So these are some pictures which are inside the containment zone. You will not see everywhere. The next, so Sehri was one thing. It was related to a particular festival. Tackling hunger was one problem which we all faced. Now people are not able to get the supplies, and here I would say that central government and state government, they combined together, and it was a very good example of federalism where they said that we need to give food. And now the food did not mean the raw material. They said because they may not have the cooking gas, they may not have few things which will help them cook, so you start giving them cooked food. And this is how we tackled hunger. We made spots where we started giving cooked food at 3 times a day, and people would come to us, stand in a line with sufficient distance, and we would serve them the food and they'll go back. We did realize this was again a difficult task, because cooking the food, then getting it, and then to ensure that it is not we are giving them good food was a difficult task, and I believe with the team efforts we made it happen. I have covered this elected representative, whether a boon or a bane, but I really feel that they helped me a lot, they helped the whole district administration a lot, because they were giving us the pulse of the people. So had we not taken their view and opened the containment zone a bit, there would have been a rebel and they would have thrown away all the sheets which you were just seen. We could not have tackled this. So this was one moment that we took the political representatives' view and tried to open it as much as possible. Now the stigma is something which was continuing, and then it again happened with me. So my driver, there was a COVID test which was going on. I said all the people who are in the district need to be tested for COVID. I don't know whether it was a right or a wrong decision. I realized everybody was fine except my driver, who came out to be COVID positive. And now apart from all these things, I was like, now what? And my parents are 60 plus. My niece was there. And this is where that personal and official conflict comes in. whether are you doing right, whether are you doing staying with your parents, is it a right thing or a wrong thing, and whether your driver, because you have to have the humane touch to that driver also who is staying with a child. So I said, okay, I'll confine myself, I'll quarantine myself. But more than that, again the media, because there was a ticker, Nidhi Srivastava's driver down with COVID. So me, my parents, and the whole district administration would have got hundreds of calls to just ask whether she is fine. Nothing had happened to me. I was absolutely all right. And I said I'll be joining my office the very next day. Because as a head of the district, if you are down, the whole district is down. They'll say, and they'll get scared. They'll say, I will not work. Those people who are actually going to the field level and working, they'll say, I'll not work because madam has got COVID, so we can't work. So I had to come back to the office and then work. So this was one personal encounter that I wanted to bring it up. I realized, so before I was in the district, I was also with one of the world's largest public utility, that is Delhi Jal Board, and there I was interacting a lot with media. But till COVID struck down, I never realized how important it was to interact with media. Because generally we are media shy, as in the bureaucrat. We would not want to talk to them, or we would not want to give them information which they want. And that is where, especially in times of something like COVID, there were a lot of rumors. There were a lot of things which were really not existing. And I maybe used my experience and interacted with media well, and that is the reason why things, at least in Central District, was under control. Our district was India's top 10 districts. So I never found myself in top 10. This was the first time in COVID that I found, and the district was also in top 10 district to be infected by COVID. So I think interaction with media did help me to take care of the whole crisis. Now the rumor thing came up, even when we were trying to give them information. But there is a class of population in Delhi who are the migrant class. People who come from UP, who come from Bihar, and several other states who stay here and work, menial labor. There was a rumor that you all must go, otherwise you'll never be able to go out to your village. And that is how I found 5 o'clock in the morning that 20,000 people have just came in one of the railway park, and these are all the people who, and they had handicaps, they have pregnant women, they have senior citizens, and they said, we all want to go to our village, please arrange. Again, this was the migrant crisis, and we saw people walking in. We saw people walking down the road because there was no buses, no public transport. They were all walking, somehow trying to reach their villages. And these are 20,000 population. This can be seen in this 20,000 population who had gathered together to get back to the village, because there was a rumor free tickets are being given, or railway tickets, to get back to the village. And we were to tackle this. So we took the help of railways and we arranged 4 trains. I never knew we can arrange trains also. So this was the first time that 4 full trains we got. And why we got? Because I made sure that all the people gathered in railways park only. So they wanted to clear their park also. They said, I'll give you 4 trains. You please send everybody who wanted to go back to their homes. So we tried to do thoda sa manipulation also. So these were the people, we tried to arrange them according to district and arranged trains for them. This was the liaison which we did with the police. And these are all the real pictures, no editing. And this is how we tried to send 20,000 people in a day who gathered 5 o'clock in the morning, coming from all the district, because in the Central District there was a bus stand, there was a train, 2 railway stations. And one day a public representative called me up and asked, Madam, do you have airport also? I said, this is the only thing which is left, please send it. I'll take care of the airport also. So this is how we managed to send everybody back home to their villages. For this, they were thankful to both central and state government, because railways work under central government. And state government helped us to push these people out to their hometowns. There were central teams from the central government's Ministry of Health who were visiting it constantly and guiding us how to go about things. Because again, there was no precedent, so they were trying to put up the best practices and do it. I'll take more than 4 minutes.
Give you Shifali's time then. She has agreed to give her time to you.
Thank you.
Not more than that.
Thank you.
Good.
There's one more crisis which occurred, which I feel bad had occurred. So, moment these COVID infected people started dying. So there was a crisis of dead bodies. We had so many dead bodies and we couldn't cremate them. And there is a hospital called LNJP in Central District, and they were all piling up. There was no way they were to cremate. There were no burial happening, and we had to put in. So we never foresaw this. We had not foreseen this situation, and we thought that this is what a district administration was supposed to do in pandemic. So that was the crisis. It was all over the newspaper. Then our Home Minister, he visited the hospital and asked us, and to his credit, I thought everything will go haywire because this was a big news that dead bodies are piling up and because infection was increasing because of that also. So this was the LNJP crisis which I wanted to bring in. We did introduce some best practices which helped us to take care of the situation. I found that the test for which the swab was to be taken, my people were walking down. Those people, without even thinking that they were in the worst of situation, they also go back home. At least I had a driver, I had a vehicle, but they had nobody. They were just walking in these narrow lanes. So we introduced these mobile vans. It was mentioned in many best practices also, in which if you can see, the health workers, they don't even come in contact. So there is a film and they were using their hands to get the swabs and helping these health workers handle the situation. We had this was called the mobile COVID testing van. Simple, we just cut a vehicle, made a enclosure kind of a thing. Our people sat inside that. People used to stand in line like that. This was the surveillance center. So now I realize that it was not only COVID, it was also the health, the psychological issue. They did not have people to talk to. So we had this 20-seater surveillance center set up with the help of public-private partnership. And all the people used to call the COVID-infected people and ask them if they need any help. Not only the pulse oximeter and all these things, but the psychological, we introduced in this the psychological health, the yoga, whatever they needed in case they need food, and for the senior citizen in case they need anything they would want to.
Thank you.
Thank you so much. Thank you so much for being a patient listener. Thank you.
Thank you, Nidhi, for this wonderful, beautiful presentation. And you really talked about the challenges as a district magistrate. One can understand and how collaboration helps in when you involve the stakeholders, how it helps you. And with limited resources, you have to perform. These are some of the challenges which a district magistrate faces. Please understand and appreciate the issues, the problems in administration. And very important, what should be the role of the media. And it is very interesting, the Disaster Management Act, as per section 67, direction to media for communication or warning. So if a district magistrate, gives a direction to the media, under this section, he is bound to publish the information. That's the power which a DM has. Thank you very much, Nidhi, for this lovely presentation.
I would request everybody to come up to the occasion, and let's get started with this second technical session for today. This technical session again focuses on public health crisis in India from a variety of perspectives. This session will be chaired by a very